Cephalexin, again, every time we hear this ceph prefix, we're automatically thinking about cephalosporins, okay? So cephalexin is the generic name for the trade name Keflex. Keflex is something you're absolutely going to see because it treats a wide variety of things that we often see in the hospital, okay? So indication for this is going to be skin infections, pneumonia, UTI, otitis media. Okay, so you can see it treats everything from skin to lungs to urinary tract to ears, okay? So we have a wide range of things that we can treat with this, and so that's why it's something that's given pretty often in the hospital. Okay, so again, Keflex or Cephalexin. Now, remember, the ceph tells us that it's a cephalosporin, so this pharmacologic class is cephalosporin first generation. Therapeutic class is anti-infective. So the way that it works is it's bactericidal like these other cephalosporins, meaning that it binds to the bacterial cell wall, and this leads to the death of the bacterial cell. So with everything that we already know about cephalosporins and with antibiotics, we know that we need to monitor our patients for cephalosporin allergy as well as penicillin allergy, okay? So it's going to be contraindicated with anyone that has a cephalosporin allergy or penicillin allergy. We really want to assess our patients, ask them prior to giving this medication if they've ever had any sort of reaction to penicillin or cephalosporin. And the reason for this is because these drugs can lead to anaphylaxis, okay? And this anaphylactic reaction is very severe, can cut off their respirations, and it can lead to dramatic reactions to the patient. So it can lead to seizures, pseudomembranous colitis or C. diff, diarrhea, and phlebitis at the IV site. So we really want to have an open IV site, something that we can monitor and assess for any sort of phlebitis. Okay. Again, assess for infection or allergies to any sorts of these medications. Obtain cultures prior to therapy. We really want to obtain a urine specimen or a sputum culture prior to doing this, so we know what the extent of the infection is, what the exact bacteria involved is, so that prior to starting the medication we can kind of direct it that way and then assess as we go on. Are we improving? Is this antibiotic actually helping? We're going to want to monitor bowel function. As we said, this can lead to pseudomembranous colitis. It can lead to superinfection, just meaning that the bacteria can become resistant to this medication, and then that becomes much more difficult to treat. So it's very important that we give the medication as prescribed and that we treat it as it needs to be. This can also cause elevated liver enzymes. So just little things that we really need to keep in mind with our patients here who are taking cephalosporins, and specifically what we're talking about here is cephalexin. This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.